Hi, Devin West here with Medicare Savings Solutions. In this video, we're going to go over the basics of Medicare. Stay tuned. Like I said, in this video we'll be going over the basics of Medicare and we'll make it easy for you to understand. We'll talk about Medicare Part A, Part B, Part C, Part D. We'll talk about the Medicare Advantage plans and the Medicare Supplement plans and what they all do for you. On a lot of Medicare publications, you'll see the letter CMS. This stands for Center for Medicare and Medicaid Services. So what is CMS? Well, CMS is the governing body over Medicare and Medicaid. They set the marketing rules for Medicare Part D prescription drug plans and Medicare Part C Medicare Advantage plans. They also provide data for Social Security. If you haven't ever seen the Medicare and You handbook, this is what it looks like. So how do you get one? Well, they're available at most Social Security offices, and you can download it online, or you can call Medicare at 1-800-MEDICARE and have them send you one in the mail. Also, they are usually mailed to Medicare beneficiaries every year, late September or early October. This handbook has chapters dedicated to Medicare Advantage plans, Medicare Supplement plans, Medicare Part D prescription drug plans, and Original Medicare itself. This is the Choosing a Medigap or Medicare Supplement Policy publication. This publication comes out every year to assist seniors in choosing a Medigap or Medicare Supplement policy. Medicare Supplement or Medigap policies are insurance policies that are secondary to Medicare and work along with Medicare to take care of the fees and costs that Medicare itself doesn't cover. These plans follow Medicare's provider network. This means you can go to any doctor or any provider anywhere in the country as long as they accept you as a Medicare patient. You can do this without referrals as well. You must have Medicare Part A and Part B in order to have a Medicare supplement plan. So what is Original Medicare? Well, Original Medicare is Medicare Part A and Medicare Part B. Medicare Part A is your hospital insurance portion of Medicare, which covers your room and board in the hospital and skilled nursing. Then Medicare Part B is the medical side of Medicare, and they pay 80% of the Medicare approved amounts towards your medical bills. Original Medicare Parts A and B do not cover the prescription drugs you'd get at a pharmacy. A lot of the seniors that would stick with Original Medicare Parts A and B would also take a Medicare Part D prescription drug plan to cover medications that you would get at a pharmacy. Then they might take a Medicare supplement plan to help cover the costs that Medicare Parts A and Part B don't cover. Another good way to receive your benefits is through a Medicare Advantage plan. A Medicare Advantage plan is also known as Part C of Medicare. This combines Medicare Part A and Part B, and most of the time Part D. This means that most of the time a Medicare Advantage plan would include your Part D prescription drug plan, and if it doesn't, then a lot of times you can add a separate one to it. So a big question that a lot of people have is, when should I enroll in all of these things? So the best time to enroll in a Medicare Advantage plan, Medicare Part D prescription drug plan, and Medicare itself is during your initial enrollment period. This is when you're turning 65, you have 3 months before the month of your birth date, the month of your birth, and 3 months after the month of your birth to enroll. Then if you don't enroll in a Medicare Advantage or Medicare Part D prescription drug plan at that time, you can change your plan or get a new plan during your annual enrollment period. This period goes from October 15th through December 7th of every year. During this time you can add a plan or you can change plans. They don't start until the January 1st of the next year. Then if you needed to, you can disenroll from a Medicare Advantage plan and go back to Original Medicare from January 1st through February 14th of every year. Then we have special election periods. These are certain situations and special situations where you can change plans or make changes during the year from January 1st through December 31st. But Medicare determines whether or not you get a special election period. For Medicare supplements, you have what's called an open enrollment period. This period lasts 6 months and begins on the first day of the month in which you turn 65 and you're enrolled in Medicare Part B. Then if you delay enrollment into Medicare Part B, you can get it later when your Medicare Part B does start. In most states, you may apply for a Medicare supplement plan up to 3 to 6 months before the Medicare supplement plan needs to start. So another big question is, what does Medicare pay? Well, again, Medicare Part A is what they call your hospital coverage. It covers inpatient hospitalization, inpatient mental health care, skilled nursing care, home health care, hospice care, and some blood for transfusions during inpatient care. This table shows what Medicare Part A pays and what you pay. To make it easy, I'll go over what you have to pay. For the first 60 days in the hospital, you have to pay a $1,288 deductible. Then for days 61 through 90, you have to pay a $322 copay per day that you're in the hospital. Then for days 91 through 150, you have to pay $644 per day. Then you would pay everything beyond 150 days out of pocket. For skilled nursing, days 1 through 20 are covered 100%, you pay $0. Then for days 21 through 100, you pay $161 per day. After that, all of the costs come out of your pocket. Medicare doesn't cover long-term care. Medicare Part B is the medical portion of Medicare. This covers doctor's visits, minor outpatient procedures, ambulance, tests, labs, and x-rays, and some preventive services including flu shots, pneumonia shots, mammograms, pap smears, pelvic exams, prostate cancer screening exams, and many others. So what do you pay under Medicare Part B? Well, this table shows what you pay and what Medicare pays. To make it easy again, I'll tell you what you have to pay. Under Medicare Part B medical expenses, you pay 20% of all the Medicare approved amounts. You also have a Medicare Part B deductible, which is $166 every calendar year. Keep in mind that all of these costs are in addition to your Medicare Part B monthly premium. Be aware that if you don't get Medicare Part B when you're first eligible, you may be penalized later when you need it. Basically, what this all boils down to is Medicare doesn't cover everything. It doesn't cover the Parts A and Part B coinsurances and deductibles, it doesn't cover foreign travel, and it doesn't cover your Medicare Part B excess charges. A Medicare Advantage plan or Medicare Supplement plan would offset most or all of these costs. At Medicare Savings Solutions, we give you free help choosing a Medicare Supplement plan, Medicare Advantage plan, or Medicare Part D prescription plan, and we also educate you about Medicare itself and answer any questions you may have about Medicare or all of these plans. We do this for free, and we are completely unbiased because we represent all of the top plans that are available to you. The best plan for you is the best plan for us, and we'll help you year after year to make sure you're always taken care of. You can call us at 1-800-663-5707 or visit our website at medicaresavingsolutions.com. Thank you.